President Cyril Ramaphosa says the implementation of the National Health Insurance Bill will be open for debate in Parliament by next month. He's delivered the keynote address at the second Presidential Health Summit held in Boksburg. Dr. Stavros Nicolaou, Senior Group Executive at Aspen Pharma Group, is with us tonight to talk more about this. A very good evening to you, Stavros. Always good to have you on the channel. So, based on the interactions at the summit in the last few days, what do you assess as the most pressing health issues in South Africa currently?
Firstly, thanks very much for having me. It's a great pleasure to be here. And I'll be speaking in my Business Unity South Africa capacity this evening. This is a position that the entirety of business has adopted. I think firstly we are pleased and welcome the fact that there was a Presidential Health Summit. I think that demonstrates where healthcare fits as a priority in the country. Where are the most pressing issues right now? The first thing is that South Africans don't have an issue with accessing health. It's the quality of health and the inequity of health that is being received. That's more of the problem. And we believe as Business Unity that the NHI Bill should be a bill that facilitates a closer private-public collaboration. The bill in its present form does speak about a single payer, single purchaser system, and we're not convinced as business that that is the most effective way to achieving national health insurance. So business is supportive and embracive of national health insurance, but it should be along the lines of a model that brings both the private sector and the public sector in together, understanding that there are both issues in the private sector and also in the public sector, but we need to leverage the entirety of the capacity, expertise and resources that reside in both of those two sectors if we are to address both the quality and the inequity that exists in the system presently.
So what tweaks then would make it a bill that you as business are fully supportive of?
There's actually not a lot that we disagree with in the bill. The fundamental section is what is called Section 33 of the bill, and what we would like to see is we don't even expect the removal of Section 33, but the tweaking or fine-tuning of 33 to enable exactly what I've said. So by way of example, the private sector has capacity to take on or develop a low benefit options. There are a number of people that are either in the informal or the formal sectors of the economy that are presently uncovered, don't have access to appropriate health care. We could develop as a starting point these low benefit options. The funding industry, the medical funding industry is very keen, has been calling on this for some time. It does require some regulatory reform, which we pressed on as an issue yesterday and the day before at the summit. So there are those type of things. We've got a three-point plan. Three-point plan is let's get an enabling environment, a bridge between the two sectors. Secondly, let's look where we can leverage a private sector through low benefit options. And the third thing, we do acknowledge that there are issues in the private sector, but those are best handled through what is called the health market inquiry, which made its findings over 3 years ago, and we are calling for the implementation of those findings. But certainly what we don't need in conclusion is to weaken either the private or the public sector at this point in time. We need the strengths of both so we deliver appropriate healthcare to our citizens.
Is there a sense then, based on your interactions at the summit this week, that government is willing to hear you out and perhaps make those tweaks?
Look, I must say the one thing about the President is he's demonstrated an interest in working with the private sector. And the best example was during COVID. I mean, he actually convened a meeting. I remember it was on the 14th of March 2020, where he got the private sector and some of his cabinet ministers. And in that meeting, the Solidarity Fund was born. Business for South Africa was born. So he is a president that demonstrably, certainly in health, has looked to work together with the private sector. And I think we're going to be leaning quite strongly on the president, the presidency, the health minister, and the various other health officials to assist and enable this building of the bridge. I think bridge building is what is needed here, rather than taking sort of binary positions. We made the point that this is not it's not a contest between the private and public sector. It's a collaboration between the private and the public sector. And I think President Ramaphosa has shown a keenness on these public-private type of partnerships.
So if those changes, the tweaks that you're asking for, are made, what would be the benefit to the country? What would business be willing to do in return?
So I think, as I mentioned, the first thing is that what struck me yesterday at the summit was there wasn't a single MEC, health MEC that is. All 9 of them were present at the summit, or their representatives were present, and every single one of them lamented the fact that in real terms their budgets keep decreasing. However, the demands and the volume of patients keep increasing in the public sector. So it's little wonder that we have things like food shortages in hospitals and overburgeoning and overburdened wards. So if we're able as a private sector to take several hundreds of thousands or millions of patients off the hands of the state, because we develop these low benefit options, because we leverage excess private capacity to use for public patients, as we did during the vaccine rollout, the COVID vaccine rollout. If we're able to do that, then you will be providing to the public sector a less burdened public sector and a budget that stretches a lot further and a lot longer than what is the present case at the moment. So these are some of the things that are on the table from us.
Right, and the NHI, the National Health Insurance Bill, has been met with a lot of resistance, yes, but also a lot of doubt around whether it's workable. Some saying it's unlikely to even see the light of day. Do you think it will?
Look, our role as businesses in a private sector is to work together with government to find solutions. I don't think we can sit and speculate as to whether it will or won't, eventually be implemented. I think there's an immediate problem here, and incidentally, a significant part of the summit focused on the here and now, the present, because there are real issues. I mean, there's not a day that doesn't go by, and there isn't an issue in the public sector, and very often issues in the private sector as well. So those are really the immediate focus points that we need to be pursuing. And if things happen down the line, they do. If they don't, let's just fix the immediate issues, and that's where our focus is at present.
Stavros Nicolaou, good to speak to you, BUSA board member, speaking to us tonight.
Thanks very much for having me.
That summit recently held, the Presidential Health Compact Summit. I was looking down to get you the correct phrasing there, should you want to read up on what it was all about and what happened. Well, that